Alkaline phosphatase, or ALP. Normal range is 40 to 130 units per liter. Alkaline phosphatase is a protein that's found in every body tissue, but mostly where you're going to see it is liver, intestines, biliary tract, bones, and placenta. But the highest concentrations of ALP, or alkaline phosphatase, are going to be found in the bone and the liver. Okay, and what the test measures, why we run this ALP, is it measures the level of ALP that's actually in the blood. All right. So most often, this test is run to detect for conditions of liver disease or bone disorders. What'll happen if there's a condition that affects the liver is that the liver cells will actually release higher levels of ALP into the blood. And so the test can be used for like hepatobiliary disorders, because what'll happen is it can detect that there's blocked ducts, like biliary ducts. Okay, so the ALP will actually be higher, and it's especially higher at these edges where these bile ducts connect. Okay, so if one or more of these is detected, or if there's some sort of tumor or something that's blocking these bile ducts, we'll actually see higher levels of ALP within the blood. Like we said, there are higher levels of ALP in the bone as well, so we can run ALP to detect for bone disorders or conditions that affect the bone cells. So for example, this can be used to detect cancers that may have spread into the bone, and if we see these elevated levels of ALP, it may tell us that if a patient has cancer, that maybe this cancer has spread into the bone. Most often when you're going to see this test ordered is part of like a liver panel. Okay, so we'll run our liver panel. One of the tests that is run with this is an ALP. And a physician may decide to run this liver panel if they see signs and symptoms that may kind of give them an idea that the patient may be having some sort of liver issues. Now, we know with liver patients, one of the things you're going to see is jaundice, right? This yellow tinting of the skin, the sclera of the eye. They may experience weakness and fatigue. They may have darker colored urine or darker colored stool. And so we'll start seeing these signs and symptoms of liver issues. And so that might give the physician a reason to want to run a liver panel. Now, they also might run it because they suspect issues with the bone disorders. So if the patient's experiencing bone and joint pain, increased frequency of fractures, or they have any sort of deformities within their bones, the physician may say, okay, well, let's go ahead and run this liver panel. And some of the tests that are going to be run with the liver panel are going to be bilirubin, AST, and ALT. And these should also be high if there's any sort of liver condition going on. Some of the things that would cause elevated ALP levels, alkaline phosphatase, so levels greater than 130 or so, would be biliary obstruction, bone disorders, like bone cancers, liver disease like hepatitis, leukemia, Paget's disease, rickets. So these types of bone and liver disorders. Some things that can cause lower than normal ALP levels, so lower than like 40, would be hypophosphatase, malnutrition, protein deficiency, and Wilson's disease. These are kind of the reasons we would run this test. Again, remember, it's alkaline phosphatase, normal levels 40 to 130 international units per liter. And a lot of times what we're going to be mostly looking for are going to be like hepatobiliary disorders and bone disease.
This has been another episode of the Lab Values Podcast by Nursing.com. We have a special giveaway for you guys, a free copy of our 63 must-know labs for nurses. To get your free copy, just go to nursing.com/labs. That is nursing.com/LABS. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.